For decades, the aesthetic medicine industry operated on a simple two-step philosophy: fill the gaps and freeze the movement. Doctors injected hyaluronic acid to plump up sinking skin and used neurotoxins to relax the underlying muscles. These methods were effective at masking the physical passage of time, but they ignored the health of the cutaneous tissue. The biological foundation of the skin was still degrading right beneath the surface. The first major pivot toward rejuvenation medicine arrived with platelet-rich plasma, or PRP. Instead of injecting synthetic fillers, clinicians utilized the patient's own blood to attempt to trigger structural repair from within. PRP moved the clinical focus toward biological healing, yet it relied on the premise that an aging body still possesses the necessary tools to reverse its own decline. Because PRP is an autologous therapy, meaning it is derived from your own blood, the potency of the treatment is limited by your current state of health. This chart compares growth factor concentrations. A youthful system produces high levels of regenerative signals. However, stress and advancing age cause these levels to drop significantly. In older patients, PRP extractions contain fragmented, disorganized molecules that lack the strength to trigger robust repair. This creates a clinical dilemma. How do you achieve profound structural repair when the biological materials used are already compromised by the aging process? To reach predictable levels of rejuvenation, the industry had to move toward a standardized, high-potency source of growth factors that remains unaffected by a patient's individual health variables. The solution came from a nanoscopic structure once dismissed as cellular debris: the exosome. Exosomes are not living cells. They are extracellular vesicles, essentially tiny, highly specialized, lab-derived messenger packets that act as biological software. Inside these vesicles, we see a dense payload of proteins and messenger RNA. Docking with a target cell, they deliver specific instructions to initiate repair. Unlike PRP, a single application delivers thousands of standardized regenerative signals, consistent regardless of biological age. Flooding the treatment area with these standardized messengers reestablishes the skin's internal communication. It forces lethargic, aging cells to behave like their more resilient versions. Because the skin is a protective barrier, clinicians must actively create pathways to deliver these messengers into the deeper tissue. During the gateway phase, doctors use precision microneedling to induce controlled trauma across the skin surface. This specific process creates thousands of vertical microchannels that function as direct anatomical highways leading straight down into the deep dermis. During the infusion phase, the exosome serum is applied while these microchannels are still open. The fluid seeps into the dermis for nearly instantaneous absorption. This delivery mechanism ensures the regenerative payload reaches the specific biological depth required to awaken dormant fibroblasts and begin structural repair. The moment the exosome infusion is absorbed, it triggers an immediate shift in the skin's biological response. Standard microtrauma treatments usually result in several days of lingering redness and swelling as the body's inflammatory system works to close the wounds. However, clinical-grade exosomes carry a high concentration of anti-inflammatory signaling molecules. These messengers directly modulate the skin's cytokine response, quenching the inflammatory process and kickstarting tissue closure. This efficiency allows the intense post-procedural redness to often vanish within a few hours rather than days. By altering the trauma response at the cellular level, the skin moves out of an inflamed state and directly into active repair. While the rapid drop in inflammation provides an immediate aesthetic improvement, true biological restoration is a long-term process. When plotted over 6 months, we see inflammation drop immediately, while collagen density follows a gradual upward curve. It takes this entire window for newly awakened fibroblasts to synthesize the thick, structural type 1 and 3 collagen required for lasting change. This internal thickening results in visible outcomes. Scar tissue softens, pigmentation becomes more uniform, and fine lines are smoothed out as the skin's internal density increases. This represents a compounding investment in the skin's structural integrity, rather than a temporary surface-level fix. Advanced exosome protocols allow clinicians to move beyond simply masking the passage of time. By using standardized signaling molecules, we can now treat skin quality as a controllable biological variable, supporting the body's natural ability to remain resilient.